Good afternoon, everyone, and welcome to the today's panel discussion. And before going, we would like to take you all to the journey of Bala Vikasa. So, we are an NGO, community-driven development activities we are keenly focused on. And we work with three major verticals. So, the first and foremost vertical is like community driven development programs itself. So we started the activities around 50 years back, and we started with social social problems, starting from water conservation, safe water, women development, widow development. We are also into like education. We are also into like micro enterprises as well. So all these understanding from working with the community, we have came up with the next vertical, which is like people training and development center. So this vertical also have like 25 years of journey, and the most and youngest vertical is the Center for Social and Responsible Business, where me and Sadhika, everyone is belong to. So this vertical focus on two activities, two major areas. So one is like responsible business, where we deals with CSR advisory, as well as like impact assessment for the NGOs, the third party assessments, and the social entrepreneurship team, where we have like an incubation program. Two cohorts are already over, and we are moving to the third edition. And we have like capacity building programs for college students, as well as like we have programs for the social startups. Apart from that, we have like regular in-house workshops and SE consultation, which is like dealing with one-on-one services and all. And then like we have a flagship event, which is like Impulse, where we are bringing around 1,000 plus social entrepreneurs, social incubators, and entire ecosystem around the social entrepreneurship. So it's like a one day full of like like expos, master classes, panel discussion, and even pitching for the selected social enterprises. So every year we are doing for last 4 years, and the fifth year edition we are in the process, we are planning it and all. Yeah, so that is more of our organization. And like Bala Vikasa, everyone relate the term with okay, we are doing something with the children's, but it's not the thing. Like it's our founder's name. It's like Bala Teresa and Andrew Gingras. Our parent organization is based out of Canada, which is called SOPAR. Yeah, that is a quick introduction of us, and would love to have you all again back for our Impulse as well. And with this thought, I would like to move to Sadhika. From here onwards, she'll be moderating the session. And welcome everyone once again. Sadhika, over to you.
Yeah, thank you, Janani. So let's get on to what we are here for. And I'll give you a very brief glimpse of all our speakers present here today, and hand it over to them to introduce themselves, because I believe they're better at telling their stories, much better than we can. So they're here because women's health in India sits at an inflection point where there is more innovation, more policy attention, more community based projects than ever before. Yet the gap still remains very wide. And today, that's why we have three practitioners working on exactly this gap, from AI-led technology, building community trust, and having sustainable solutions. We have three speakers for that. First, so I would like to introducing all of them. And first, we have Anju Bist ma'am. She's the managing director of 𝐸𝐸 Foundation, which has been building sustainable community-centered menstrual health solutions at the grassroots level, wrestling with the very real tension between being eco-friendly, affordable, yet accessible for women at the last mile. So, Anju ma'am, will be really good if you could tell us a bit about yourself and uh, what brought you to this work as well, because you've been working in this domain for a very long time.
Yes, thank you, Sadhika. And thank you to all of you for organizing this very important conversation on Menstrual Hygiene Day. Menstruation, directly related to women's health. And for a long time, or even now for that matter, we don't openly talk about it for the most part. Things are changing. So what brought me to, I've been working in the field of menstrual health for over a decade now. We were a Government of India, DST, Department of Science and Technology funded research project at Amrita University. And then reusable pads using banana fiber as absorbent, they were launched in 2017. So 2017 to today, it's to 2026, 9 years. We have reached 30 lakh women, mostly in rural and tribal areas. And the last 2 years, our energies have been spent on making the case for reusables, not only from an environmental perspective, but also from a women's health perspective. We recently completed the analysis of a large data set with responses from 10,000 girls, 10,000 plus girls. And of course, these responses are from rural India. It was shocking to us also to discover that so 4 types of period problems were studied. There were a whole host of questions that were asked, and then the focus was also on these period problems, 4 types: rashes, cramps, irregular periods, and abnormally heavy flows. Of course, many of us think we have heavy flows. So not heavy flow, but abnormally heavy flow. And the data revealed that 8 out of 10 girls suffer from a combination of these problems, either one or more of these problems. And we may think, oh, rashes, that is caused by sanitary napkins, isn't it? But our take on the matter and our sort of grassroots work, the case studies we have compiled, tell us that somewhere all of these 4 problems are linked to the sanitary napkins we use. The chemicals and toxins in them disrupting our hormonal system. And if we are away from these chemicals and toxins, even a short period of 6 months, that can lead the body to heal. The body knows how to self-correct. And a lot of the problems we can get rid of. Of course, this is not a substitute for medical advice, and medical interventions are needed but it's a pandemic-like situation today as far as reproductive health issues are concerned. The springing up of IVF centers everywhere, and we're not talking about the obvious elephant in the room, the sanitary napkins, the toxins and chemicals in them, and how they are impacting our reproductive health. So what led me to this work? We were working in rural India, and we had appointed, tuition teachers and health workers and trained them and so on. And the advice that came from our mentor, Ammaji, Srimata Amritanandamayi Devi, that unless we tackle the problem, unless we go to the root of the menstrual health issue, it's only surface level changes that we will be bringing in the both education and health domains. So that is what motivated us to get into this area. And then one thing led to another. And today here we are. So I hope I answered your question.
Yeah, thank you so much, ma'am. So next, we unfortunately could not have one of our original panelists, Sanya ma'am, but from 𝐼𝐧𝐬𝐞𝐧 Foundation, but instead she very graciously recommended Aditi Payas ma'am, who's a mentor for 𝐼𝐧𝐬𝐞𝐧 Foundation as well as the CEO and director of Pune Swasthya. So Aditi ma'am brings over 2 decades of experience across healthcare technology, rural health, and women empowerment, and she holds a Guinness World Record for making a sustainable menstrual hygiene mosaic, which I think it says everything about the energy which she brings to this work. So Aditi ma'am, if you could briefly introduce yourself and your work.
Right. So, Sania is the founder and director of 𝐼𝐧𝐬𝐞𝐧. I became part of 𝐼𝐧𝐬𝐞𝐧 because I felt that, the girls around me, and I was raised in a very open family, somehow I never went across any taboos or any myths which were around menstrual, the days or the whole menstrual health which a woman goes through. But the more I started living outside my own house, I could feel that there is a lot of work which can be done into the various verticals which involves menstrual period of a woman. So I believe that we should start at the age of 13 and we should be there with her till the age of 60 probably, which starts with the puberty and ends with the menopause. Okay. And in that whole journey with Sania, and I also have a Purna Swasthya Foundation, we also work in lot in women empowerment through giving them the right idea of their own health. So 𝐼𝐧𝐬𝐞𝐧 has this particular statement or a slogan which we always says that period sharm nahi kshamata hai, and we believe totally into that the kshamata which we have, the capacity which we have, and the sheer reason why the whole world exists is the reason that women menstruate. So instead of making it a taboo or making it look like a problem, which we generally call in the in the student age, that I'm having a problem, somebody's going through a problem, let's tackle it like a normal scenario. Let's make sure that we talk about it, and that one thing led to many other things, and we are happy that 𝐼𝐧𝐬𝐞𝐧 is doing very well into spreading the awareness, spreading the green menstruation awareness as well. And my organization Purna Swasthya also believes in women empowerment by giving the right education to the girls and to the women at menopause, taking care of their health and even mental wellness, and that is the whole package we provide when it comes to the platform. Many reasons, but yes, I'm very happy to be associated with this cause.
Thank you so much, ma'am. You're very right that there is still a lot to be done to be normalized, to have normalized conversations around menstrual health. And we would definitely like to hear more about it in depth. But before that, I would also like to invite our third panelist, 𝐶𝐻𝑖𝐨𝑎𝑛𝑖 Garg ma'am, who manages global health programs at 𝐶ure AI, which is one of the leading AI diagnostics organizations working in India, where Shivani works at the intersection of AI and global health strategy on making AI-powered diagnostics in the public health infrastructure of low and middle income countries. And before 𝐶ure AI as well, Shivani has led an accelerator supporting health startups in sexual and reproductive health. So Shivani, if you would introduce yourself.
Yeah, thanks, Sadhika. I think it's so great to be on the panel with such amazing panelists who have been working so corely into the menstrual health and specifically on the women empowerment. I think first of all, this topic has been very close to my heart because during my education, during the days of my public health studies and all, I have been engaged a lot with various local NGOs and the community centers who have been working a lot into the menstrual health part. And I think my journey into this public health domain has been very unconventional. I started my career in biotechnology, but I have always been realized that some of the biggest healthcare challenges are not only scientific, some are very deeply human. And the diagnosis or the medicines and even a breakthrough technology means very little if it cannot reach to most of the people around. So like after working a lot on the ground, I have realized that that there has to be some opportunities that how we can work closely into the health system to make it more accessible. And nowadays, with technology coming into the picture, it is more about how we can accelerate the current support, how we can enhance the current services that are available at different level. And interestingly, I think this shift in my career has helped me in understanding how I can be more engaged and can bring more into the picture for healthcare equity. Because I believe, the real challenge is not about just creating an innovation. It's more about how you can bring that innovation to the ground, how you can make people understand that it will not going to be degrade your current health, it will not be misguiding you, but how it will be more affordable and impactful in the community around. So I think I am very excited towards today's discussions and learnings from this panel today. Thank you.
Yeah, thank you so much, Shivani. As you rightly said, bringing the innovations to the ground is the most challenging part. And I think we can begin with our questions. One which I have for Anju ma'am is that Saukyam has been working on this very uh, problem of bringing the innovations to the people. And so in conversations around menstrual products, affordability, sustainability, they often get pulled into different directions. But how did you actually design these solutions for the community, and which are community centered, and how did you really scale uh, Saukyam without losing sensitivity to the local community, their realities, cultural practice, and whereas also like normalizing uh, the conversation around menstrual health?
And thank you, Sadhika. Yeah, it wasn't easy. I can tell you that. 9 years ago, if we were facing questions that, so I often like to tell this anecdote that, yeah, so it wasn't easy, but it wasn't that difficult either. And it's been a very fulfilling journey. Let me put that, give that sort of disclaimer up front. So earlier, when we would do awareness workshops, and say we would do them in schools or colleges or what have you, and sometimes, a lot of times in rural areas, but sometimes in cities, many times in cities as well, not a single hand would go up if we were to ask, have you heard of reusable pads? And by the time we came to the section where you have to talk about the washing and the drying and the reusing, people would look at us like we had lost our minds, and we were expecting people to reuse the same product, touch our blood soap pads, and then we are like, but that is what nourished us. Menstrual blood does not smell. Menstrual blood is not dirty. Menstrual blood is what nourishes the fetus. We were all nourished by our mother's menstrual blood. It's not waste product like urine and feces and so on and so forth. So, but it changed. Today, when we go to classrooms, I would say about 50% of the hands go up if you ask, do you know of reusable products? Do you know of reusable pads? Do you know anyone who's using them? Are you using them? So maybe again, we are back to, few hands only, but at least people today are aware of these things. But what saddened me a little bit yesterday, I just give you an example from that. We had a very beautiful event planned for HEAL. And this is what I was talking about earlier for girls with menstrual disorders. And the chief guest, the mayor of the city that I'm in. So, and she was absolutely right. She was asking. So here we are trying to build the narrative that needs to be really built and that needs to be discussed, that our period problems could be because of the toxins and chemicals in disposable sanitary napkins. And then in the same platform, there's another point of view that's being presented. Are reusable pads even hygienic? Why would we bother washing and drying them? in these modern times, aren't you promoting regressive solutions? And Mayor Ma'am was like, I know the answers to all of these. I don't think they're regressive. I don't think washing and drying is a big deal. I think they're very much the need of the hour. But you need to answer all these questions again and remove the doubts that are there in people's mind. And frankly, I was a little saddened that even after 9 years, we're still having to start from, so to say, from ground zero. So the challenges are there, definitely there. I just wish more folks would join hands so that these narratives that need to be built can be built much sooner, much faster. Hope I answered your question.
Yes, ma'am. And that, so as you mentioned, menstrual health programs cannot just distribute pads, run awareness workshops, and hope for an intervention to come across. So, my next question would be to Aditi, ma'am. So, as I said, what do you think that organizations can do differently beyond showing PPTs, classrooms, and having classroom-like teaching sessions to create stronger engagement and more effective results amongst the girls and as well as the community?
It's a very good question, So it's been more than 9 years or 8 years, we are doing the sessions, awareness sessions. We never believed in doing any, or I personally also don't believe in doing any training or a session which is a classroom style. Okay, if I'm running a PPT, 10 seconds and people are, going here and there, their mind is not there. Basically, with the topic, which is such a big taboo in girls' head, in women's health, we generally believe in going like a storyteller. Okay, first is ice breaking, understanding that what kind of people we are talking to. Right now, we have a variety of ages we cater. It can be adolescent, it can be even 25-30 years old women, or the older woman who's into in their menopause, but they have daughter-in-laws and daughter at their home. So we have to talk about all the ages, and when we talk to all the ages, first thing is breaking the ice considering the age. Okay, never is a session successful if it is a school type or a classroom type. What we try to do is we try to embed them, or we try to engage them through different stories. Okay, probably some stories which we came across from previous sessions, probably some stories they come out. Of course, Anju ma'am said it, the raised hands are very less. The people who want to talk about, people who want to be very clear about this topic are very less till today. But there are few stories, there are few way, there are few, we have some boards. Okay, we have some, we have a mechanism to make sure that even the 8-10-year-old girls comes out and says, yeah, my mama told me about this. Okay, but I am scared to discuss, right? And then there are stories which tells you that I am married, and in my in-laws house I am not supposed to do that, and I go through this problem. So all these things will come out only and only when you talk to them in a story, when you talk to them like a friend, and when you make sure that there is no, they also understand that the lady in front of me goes through the same thing what I go through, or I will be going through, and it is absolutely okay to discuss about it openly, right? And that kind of a build up is made when we go and talk to them. It has been many a times where we have an event happening in a temple. Okay, and we see ladies sitting outside, forget what traditionally is been taught to us, but those women feel sad that traditionally we are following something, and that is why we are not part of this program, right? These kind of taboo, these kind of myths has to be broken, and that can always happen in a storytelling, in more of a one-to-one conversations with them. And it is never something which the paper is telling you or something is on the blackboard. It is more of what we convey to them through our own experiences. Okay, so that is how we try to do that. It is never gets over in that session. They always take our numbers, because the fear of discussing about this topic is so much inside us, that till today when we go to a medical shop, we hide the pads in the paper bags and put it in the black bag and bring it, right? So if we need to move out of that, we need to do a lot of hand holding and we need to do a lot of ice breaking, and then only we will able to put that term in front of them very easily. And that's what we try to do it each and every session.
Yes, ma'am. As you said, you know, uh, we need to understand the lived experiences of these women. In the
Yes.
same way, even Shivani. So even I would say data, all AI and data also needs to understand the lived experiences of women. So one thing I would ask you is, if a data set doesn't include women's bodies, women's symptoms, or their lived experiences, so an AI trained on it will confidently might get women's health wrong at scale. And but you have been working at the forefront of it. So what is Cure AI actively doing uh, for to fill a gap on those blind spots? And what do you think AI in healthcare is still avoiding?
I think I will not say that AI in healthcare is avoiding, but if you see,
Hmm.
AI role in healthcare is basically to assess, to accelerate, and also to expand the reach, and not exactly replacing the healthcare system or the human care. In Cure as well, we are trying to use AI that can actually help in doing early detections, reducing the diagnostic delays, and also to reduce the overburden clinicians at the PHC or the CHC levels, and how we can augment the current workflow, or how we can bring a clinical decision supports at these low resource settings, so that the right decisions can be taken, or the right informations regarding what type of test needs to be done with the with the patients, or if there are any early detections that can be done through an AI. In that way, AI can be supportive. When we talk about the women health, we understand that early detection can significantly change the outcomes, because usually women's health diagnoses are late due to various reasons. It can be social, it can be structural barriers and all. But where I see the equity between the health and the AI can work, when the care is affordable, there can be a follow up pathway that can exist, and also how the woman can feel safe seeking these cares and all. For example, if a woman, we see that receives an abnormal screening results, but there is a lot of but cannot take the time off from their work, or there are a lot of stigmas that are around her, maybe, and or maybe the referral center is far away from her. So here AI has technically worked. It has helped in detecting the abnormal screening, but the health system here has somehow failed her. So in this way, I think we can see AI as an enabler with a very much larger ecosystem, and with to create that kind of environment where these services can be availed, we need to create that kind of partnership across technologies, across the community organization, policymakers and all.
Yeah.
Yeah.
Thank you for that. So, I think I would move over to asking another question to Anju ma'am. And ma'am, for your work sits at the intersection of environmental sustainability and women's health. And as conversations around menstrual waste and sustainable alternatives have, as you mentioned, they've been becoming more uh, prevalent in the last few years. How can we make sure that sustainability doesn't become another burden, kind of a burden placed on women, and especially for women who are already navigating economic constraints and would prefer going for the cheaper alternative?
It's, excellently put. And 2 points come to mind, Sadhika. So, uh, you know, reusable products generally, for folks who are able to make a successful shift to them. And I'm talking about not just reusable pads, there's also, of course, period panties, there's menstrual cups. A lot of women mix and match and use these. The period experience is far more comfortable, far more comfortable. Again, this conversation does not happen openly, and we don't generally talk about our experience. I think Menstrual Cup, one of the brands poured a lot of money into advertising, which is why, uh, uh, we know about menstrual cups giving us a comfortable period experience. But it's across the board for all reusable products, period panties and reusable pads included. In fact, for a lot of girls who may be intimidated with something, with having to insert something, it's an easier start if they start with just getting over that mindset of, oh, we have to wash and dry. So, disposable sanitary napkins are made from cellulose fiber. Cellulose fiber is obtained by cutting down trees. They are, in fact, a driver for climate change. Again, this conversation never happens. We don't have to place the burden of sustainability, or, we don't have to ask women to choose based on sustainability concerns. We should just ask them to choose based on what's good for their own body, whether it's period experience, period comfort, or being safe from long-term exposure to toxins and chemicals. And what's good for our body is also good for the planet. There's really no choice over there. It's not as if you're choosing one or the other and, having to weigh, okay, do I go in for sustainability? Do I go in for my health? Do I go in for period comfort? Well, the answer to all three of them is actually the same category of product. But again, I wish more people knew that, more people talked about that. Without the support of advertising budgets, also, this conversation became mainstream and, more folks knew about it. So now, coming to your second point regarding the cost, with most reusable products, you would actually end up saving 70 to 90% of the amount that you would otherwise spend on repeated purchases of disposables. And always in our workshops, we have folks do this math, that if 1 month your sanitary napkins cost you 100 rupees, say, then in 12 months, that is 1,200 over, 40 years perhaps of your menstruating lifetime. It's nearly 500,000 rupees. And that's when it suddenly hits, oh, I'm spending so much, but I don't understand it because it's boon by boon. It's little by little. With reusable products, your lifetime expense is perhaps 10,000 rupees or more, or less. But the thing is, in reusable products, so I'll give you an example of a water bottle. You buy a disposable water bottle, it costs you 20 rupees. But you buy a steel bottle, say, it will cost you a few 100 rupees, isn't it? We don't mind paying that few 100 rupees because we know that it can be reused and so on. But suddenly here, a disposable pad costs you 5 rupees and a reusable pad costs you 50 rupees. But we are like, okay, 50 rupees is too much, even if it's going to last me 3 years. But actually, I'll tell you something. Cost is not a conversation at all. A lot of folks from low-income communities go in for reusable products because they understand very clearly how it helps them save money. And the fact that you have to pay more upfront is a factor when we start work in a new area. And we usually try to subsidize at that point. But usually it's not a limiting factor. I will tell you this from my own experience. So again, hope that was...
Yeah, that is wonderful to hear, ma'am, because I myself switched over to Socyam Pad 7-8 years ago when a friend of mine from Kerala introduced it to me. And at first I was like, okay, why is this so expensive? But then, as you mentioned, we sat and did the math, and now I don't know, since the past 7-8 years, how much money it would have saved me. And but definitely the experience around periods that shifted, my own mindset shifted. And I would like to ask a similar question to Aditi ma'am as well. So ma'am, you've been working you've worked on different problems and solutions around women's health and menstrual health. So you would know behavioral and cultural change does not happen in one place. It doesn't happen where we build the solutions, but it happens in classrooms, in houses, in conversations between uh, mothers and daughters, uh, within the families. And so what does it really take to get there? And what is that turning point when and our activity or our solution becomes a normal conversation?
Sadhika, our conversation in the house is not only mother and daughter, right? Our conversation in the house is the father, is the brother,
Hmm.
grandfather, uncle, and nowadays we don't have a joint family, so we have probably the father and the daughters. Hamjoli Foundation always believed that, me and Sanika always makes a joke that menstruation, menopause, everything has a man.
Yeah.
Okay. Then why, when we talk about periods or menstruation, we avoid a man or a boy? Okay. We always ask our community helpers who arranges our sessions or the places where we go, we push through having men for a session before we actually tell a woman to come out of that the myth or the taboos or the day to day the sush and hush pattern of the having periods kind of. Okay? So we ask men to be part of the session. We ask the young boys who will be looking at the girls who will be menstruating, who may have stained their skirts and dresses, and the girls' brothers who will be told, don't touch Didi, Didi 4 दिन इधर खाना नहीं खाएगी. These questionnaires and these kind of thing, if we don't talk to the men of the house, okay, including the brothers and the uncles, when will we talk about it openly? Okay, if a man can talk about Hema Malini openly, why we are not talking about what a woman goes through openly in the house? So for that, we have some ABs, we have some ice breaking things with men. We have some particular, detailing which we do when we talk to the men. Okay. See, the thing is this, as Anju ma'am said, you can buy any product. Okay. First of all, India is on such a threshold where a woman needs to understand what is hygiene when it comes to menstruating a woman. Okay, that is a total different ball game when we talk about the hygiene of a menstruating woman. But when you talk about the hygiene products, okay, most of the women till today when we talk, there is a earning man who comes in. Okay, we are not talking about tier 1, we are talking about down the line tier 2, tier 3. When an earning man has to shed the money, okay, he should know why he's shedding the money or why he's giving the money to the women. And there this kind of a ice breaking comes in the picture, that yes, a woman needs a hygiene product. That is where a man should support a woman, a brother should support a sister, or a friend should support a friend who will be sitting in the class and suddenly start penetrating, wets her skirt or had some, daag aa jate hai. All those things are, it's a package. You can go and talk to 100 women, and you can tell them that, be very careful with your hygiene, be careful, you can use any kind of hygiene product which you have. You can use pads, or you can use the cups, which is very very useful nowadays. But ये सब करने के लिए जो घर से सपोर्ट मिलेगा ना, वो बहुत ज्यादा जरूरी है. ओके, एंड वी बिलीव दैट, so I totally believe in this concept that when we talk about a very open youth or a young prospering youth of country, the youth should also be aware of what his woman is going through. Okay, or what his sister is going through, what his friend is going through. So if I tell you very openly, I spoke to my son when he was in grade 7, and I told him there can be a point where you see a friend of yours going through this, you need to be a friend. Okay, you need to be a friend, you need to be there. And I'm very happy to tell you that because these kind of conversations took place in the house, he was one of the champions who were helping his friends in a camp where they were talking about distributing the pads and talking about menstrual hygiene. I think if all the women in the house starts breaking these kind of ice in the house, and it becomes more easy to talk about. Like अगर सर्दी खांसी होती है तो हम लोग कहाँ छुपाते हैं, तो why are we not talking about this? Okay, क्लास से भी बाहर, मतलब टीचर तो है ही जिसके बारे में बात होगी, लेकिन the it says ना कि charity starts from home, like that everything starts from home. So we have to start this from home, so that will make sure that these kind of conversations are going very easily in the house.
Yeah, thank you, ma'am, for also touching upon the conversations around equity. And so one question I want to ask Shivani also revolves around equity, but I want it's around AI. So where do you think AI's role in women's healthcare, where does it end and where does the real work of equity begin?
Yeah, sure. Thanks, Sadhika. First of all, I just wanted to say thank you to Aditi for highlighting that example of her son. Actually, that reflect a lot of memories of mine working in at the camp with a lot of other individuals, and then making them understand about what is menstrual health and all. Thank you, Aditi, for that. I think when we talk about AI, we understand that AI, we understand that there has been lot of implementation challenges when we talk about any kind of program or any kind of change that we want to bring because of some social norms, or and I think before technical challenges, these social challenges come in the picture. Technology can help in making the system more ease. It can help in enabling the system. It can help in making the process easier for everyone to access the services, to get the results easier, and also to get the right results at the right time. But if the access is the problem, if the social norms and the conditioning is the problem, then the access of the healthcare is not possible. Even for the women, we see that there are a lot of women across the countries living in the smaller, low resource settings are still fighting across with their own family members or the societal norms to get the access to the right services, due to which there has been a lot of cases in terms of PCOS, PCOD, or endometriosis, etc., in the menstrual health itself, because they are not getting the right access to the services. So I would say equity can only begin when the care is affordable, the follow-up pathways exist, the women feel safe seeking the care, and also when the healthcare workers are trained and the systems are designed in a way where women can expect to receive the right information and the right care. I will give you an example. While we were implementing one of the programs at Japaigo for adolescent health, we were actually focusing on how we can improve the access to sexual reproductive health and family planning services. And I think at that time we did a lot of campaigns online and offline, and one of the major challenge that we found was the knowledge of the healthcare workers who were providing this information to these young individuals who might don't know about what is sexual reproductive health, what are the family planning methods available in India, and based upon their own choices, they were actually providing them the informations or making the environment so toxic for them to receive that kind of information in unbiasedness, in full privacy and all. So you can use AI or technology for detecting the disease early, for supporting the healthcare workers, and also for training and capacity building of these healthcare workers, so that they can take the right decisions, do more physical interactions with the patients and all. But if we want to bring in equity into the system, then we need to bring all of them all together. We need to improve the partnerships. We need to make understand the healthcare system as well, that AI is not replacing you, but it is actually enabling your system. It is actually giving you that space where you can talk to the patients, ask about their well and know, recommend few things which you might miss while because of a lot of burden at these healthcare workers or clinicians at these centers.
Thank you so much, Shivani. As you wonderfully mentioned, it's the partnerships which really bring together in solving community problems and actually implementing those solutions at the ground level. So and all of you, it's been a wonderful conversation. I think we have a few people with us, so we can open it for a Q&A, and we can take a couple of questions. I see Bharadwaj sir and Tanisha ma'am, who both have been working on healthcare for women, and they were also a part of our event Impulse. So, ma'am, sir, if you would like to ask any question, or anyone else from the participants, you can ask questions.
Yeah, so I'm Bharadwaj. Yeah.
Yeah, hi, I'm Danisha. It is very nice listening to all of you and great insightful thoughts. We are actually building an ecosystem revolving around the whole, women's healthcare, as in, and it is very nice to see different domains in the healthcare. There, ma'am, working on the product and other Aditi ma'am working on the awareness and Shivani ma'am working on the AI and so we are integrating all of this and like to create awareness and to bring in our service to them like because each woman is different and they would require special care and personal care and
Danisha, we can't, we
how
lost
do
you
we
in
approach?
between. So if you could repeat what you said.
Just give me a moment.
Yeah.
Sure.
Meanwhile, Bharadwaj sir, would you like to go ahead?
Yeah. It was nice to hear a lot of things from the panel, and it was very educating. So we are working in the same space. We are creating an ecosystem where we are starting off with services as well as products also. So I'm not too sure what Danisha wanted to ask. So we are in the same space. We are also working in the same space. Like Shivani Garg ma'am said that we AI. So we have an AI already deployed within our app, which is actually trained in WHO standards, data sets and standards, where it is actually it's not giving clinical advice, but it is actually giving valid advice to that critical movement. So just wanted to know how can we help you, or you can help us. Danisha, please go on.
No, so I was trying to ask about the women regarding the products and services. I know it's a very tedious process, and like how do we approach and bring in the product which is valuable for women. So that's what I wanted to ask.
So I think Danisha, something from me. Recently I read a very horrible news of a lady passed away because she took some medicine and that thrombosis took place. She wanted to delay her periods because she wanted to attend some religious ceremony. So if these kind of things are happening in the community around us, okay, we need to bring in a very full-fledged, what you say, a program, okay, or a full-fledged, like a syllabus or a book kind of a thing, a virtual book probably, which talks about the impact of the medications, like how ma'am is talking about the impact of sanitary napkin. We need to integrate these kind of impacts together because it is eventually hurting a woman's health totally. Okay, one case came in front of us, so we got to know that woman actually passed away after taking the wrong medicine or whatever. So it doesn't start with only with using a hygienic pad. It starts with how your periods are mirror of your health. Okay, and when we talk about that, we should include this together, and it should come across one umbrella which talks from, as I said, talks from the age of 13 to 60, that is the menopause, and that can, break the ice, that can bring all the aspects of this menstruation together, which will eventually help the reproductive, the whole system of a woman. So I think what you are trying to do is, integrating the AI part and awareness and the care part together. It can be a really good mixture. Amalgam of technology and human interface is one of the best thing to happen in India, because India is still not robot ready. Okay, so we have to be there with people. We have to have some evidences, along with that, like AI, data and clinical assessments, and that will give you a clear idea and a path how to bring that to the market, or how to bring that to the people or women, which will be very, very beneficial for them. That's what I think.
I just wanted to add a point here, Dinisha and Bharadwaj, that I think at 𝐞𝐞, we have not extensively working on women health specifically. There are other areas that we have been focusing more, which is TB, NCDs, and HIV. However, while working with 𝐭𝐻𝐒, I have extensively worked in this area, and we have also supported few of the enterprises who were working in this space of SRH and family planning. If you must have heard about Bliss Pads or Pinky Promise, so all these have been our cohort partners whom we have provided the technical and marketing assistance on how they can make their product more accessible, how they can market their product in the low middle income, in the low community outreaches, what kind of areas they can work upon. And I think that one area definitely you should explore in terms of AI has been evolving a lot. You must have heard about 𝐻𝐸SA, that has been working on the mental health for the SRH space itself. That was also one of the organization we have incubated during our cohort as well. And I think one of the challenge that whenever you are using an AI, just make sure it has been guided by the clinical protocols or the guidelines of the country and the community. And also, while implementing these AI products, one of the challenge that we have found is the language. People usually look for the local language. If AI is able to speak to them in their local language, they will interact more with it. They will find it more interesting to understand as well. And also, how that also we have to create that kind of environment or the ecosystem for these individuals, specifically these women who might don't have their own phone or don't have the access to these technologies, that your information is not going outside, it's just kept here. So I think that data encryption thing is very important, or the compliance issues whenever we are using AI into these ecosystems or have been using these technologies to provide these kind of information. These needs to be very much validated, and also the what kind of information is actually influencing these people is also very important.
Thank you, ma'am. Thank you.
I can give you a perspective from, reusable menstrual products. So I don't think there is a marketplace that exclusively features. Of course, if you were to go to Amazon, you will see, all the different brands. But it would be nice if there's a platform that sort of unpacks reusable menstrual products and also lists all of them. We do the same work, but in offline spaces, not online, in offline spaces in college campuses through a care program. And I'm here in Bhubaneswar. Yesterday, we gave awards to almost 35 care mentors and ambassadors who together in the last 1 year, all of their efforts, some may have motivated 10 people to shift. Some others have motivated 500 to shift. So their cumulative efforts have come to over 5,000 numbers of young girls who made the shift. So tremendous scope. And what did they really do? They unpacked it for girls who were anyways wanting more information and were, I would love to hear from Sadhika also. She mentioned that she's using reusable pads for more than, you mentioned 7-8 years, right? So what motivated you? How did you get the information? How could you make the switch? Was it difficult at first? So some kind of platform that provides this support. And because in 1 year, if 35 people could motivate 5,000 menstruators, an online platform can do wonders, isn't it?
So, ma'am, so that's what we're trying to build here. So we're trying to build an ecosystem with, sustainable products as well as services with the help of technology. So integrating all of this to create that safe space for women and children. So I'll be very happy to collaborate with all of you. So currently we're in our MVP stage, and once we are done with the pilot stage, we are trying to test it out with 200 women, and then I'll reach out to you, all of you, and how see how we can take it forward from here. Thank you so much, all.
Thank you so much.
Thank you, Danisha, and thank you, everyone. So, are there any other questions from the participants? Or we can, since it's time, we can take the, if there are any other questions, you all can share it to us later on, and we can share it with the panelists. So, yeah, we've talked about innovation, access, trust, stigma, sustainability, and what structural change actually looks like to. So thank you so much, Anju ma'am, Aditi ma'am, Shivani ma'am. This has been exactly the conversation which we were hoping it would be. And when Janani was even planning for it, so she's been planning for for over a month. So I think I'll hand it over to you for the closing remarks.
Yeah, thank you so much, Sati. And it's wonderful conversation and much needed conversation also, because as a director, I am also part of like an organization which is supporting women awareness around the same, as well as like we are also having an incinerator as well as like vending machines for the colleges and the space where students are there. So like we can also see the similar kind of like taboo, even though like 10 people coming together and working together, the number is so huge, because the to reach out to each and every nook and corner and come up and get rid of this kind of like a societal taboos, and also the cultural beliefs, breaking it, and working towards sustainable products, or like taking up that kind of like a conversation itself very hard. So as a like a part of Balavikas also, like I'm really thankful that everyone have joined together in this wonderful space for the woman, and I'm really grateful for taking your everyone's time and being here. Thank you so much. And we'll be reaching out again for our flagship event and all. It's wonderful to have you all join us. Thank you once again. Thank you for the participants as well. Like if you have any further questions or connections needed, please do reach out to us. We'll happy to provide and connect you all. Yeah, thank you. Thank you, Sadhika. You did
Thank you.
job.
Have a good evening. Yeah.
Thank you.
Thank
Thank you,
you.
Sadhika.
Thank you very
Bye.
much.
Bye.
Thank you. Thank you.